Greetings, my sisters and brothers. My name is Martise Chisholm, and I have been a registered nurse for 28 years, currently caring for patients in Chicago. I am also a proud board member of National Nurses Organizing Committee, an affiliate of National Nurses United, the largest union of registered nurses in the United States. As nurses, we make an oath to protect our patients, and the reality is that my colleagues and I have to protect patients from our own healthcare system. That's why nurses have been working for decades to achieve Medicare for all and to bring to life a more humane healthcare system based on patient needs, not on suffering and private profit. The intersection of healthcare justice and racial justice is critically important to us, especially as we see firsthand on a daily basis the disproportionate impact of the COVID-19 pandemic and our profit-driven healthcare systems on communities of colors, on our patients. Before COVID hit, even with the ACA having passed in 2010, over 29 million Americans were uninsured, and a minimum of 44 million were underinsured. Amidst the pandemic-induced recession, it is estimated that nearly 100 million Americans cannot get the health care they need. Before the onset of COVID, so we know these numbers are considerably worse. Approximately 4.1 million African Americans did not have insurance. Approximately 9.1 million Latinx did not have insurance. 6.8 million of them are undocumented immigrants. People of color are less likely to have employment-based health insurance, less likely to be able to purchase it on their own. Even when Black, Indigenous, and other people of color patients do have insurance, we bear direct witness to the heart-wrenching decision they and their families are forced to make because they cannot afford the care they need. People of color pay a much larger portion of their income on health insurance premiums, co-pays, and deductibles than white counterparts. As a nurse, I am intimately aware that our current healthcare system fails our patients and reinforces the racism, xenophobia, and classism against which our nurses union stands wholeheartedly against. During this COVID-19 pandemic, I have seen patients come to our emergency room in severe COVID distress. They stayed at home because they were uninsured. Everyone here knows by now that Black, Indigenous, Latinx, and Asians are disproportionately affected and die from COVID-19. Black and Latinx Americans are 3 times more likely to become infected with COVID 19 than white Americans. Native Americans, Blacks, and Latinos are being hospitalized from COVID-19 at around 4 times the rates of whites and are dying from COVID-19 at about twice the rates of white people. And the number of Asian Americans dying from COVID is on the rise. An article in the July publication of Health Affairs stated that in San Francisco, Asian Americans represented half the COVID-19 deaths, though they are only 1/3 of the population. Multiple generations of racial health disparities created by a racist society and shaped by a racist healthcare system render us more vulnerable to getting COVID and dying from it. This discrimination extends to the lack of protection of frontline healthcare workers. Both our healthcare system and our elected officials have failed to ensure that nurses and other frontline workers have even the most basic level of personal protective equipment, or PPE. As of December the 30th, over 590,000 healthcare workers have been infected. 283 registered nurses and 2,593 healthcare workers have died from COVID-19, a disproportionate number of whom are BIPOC. Filipino nurses, in particularly, have been hit hard. About 1/3 of the nurses who died from COVID in the US are Filipino, even though Filipino nurses make up just 4% of the nursing population. Most of these deaths could have been prevented had our elected officials and hospital employers taken appropriate steps to protect us. We nurses are beyond outrage and have been organizing more ferociously than ever to get ourselves the protection we need to fight this pandemic. Over the last 11 months, nurses have held thousands of demonstrations at facilities across the country, demanded the PPE, regular COVID testing, and safe staffing that we need to safely take care of our patients. What we're up against is a profit-driven healthcare system that always wants to spend as little money as possible, even when it puts nurses and patients at risk. Medicare for All will remove the profit motive that endangers our lives and create a system based on patient needs and patient care. And it will ensure that optimum staffing levels and other protections are prioritized, centering the needs and creating safer conditions for patients, nurses, and other healthcare workers. We are in this fight together, and we know that when we fight back, we win. Under the leadership of our executive director, Bonnie Costello, herself a nurse and a woman of color, we drive the Medicare for All movement because we believe it is a significant step in the process of dismantling racism in healthcare. The fight for Medicare for all is a continuation of the legacy of the civil rights movement of the 1960s, when Medicare was instrumental in desegregating hospitals in 1964 as the Civil Rights Act was signed into law. My great-grandmother was a civil rights activist in Mississippi. She marched with Dr. Martin Luther King Jr. and Congressman John Lewis across the Edmund Pettus Bridge. She got into good trouble, necessary trouble, for voting rights. Now is the time for us to get into some good trouble, necessary trouble, for Medicare for all. If we are to address systemic racism in healthcare, it must be done through wholesale transformation. A first significant step in the right direction is passing Medicare for all and guaranteeing comprehensive medical care to everyone in the country. We have been able to grow support for Medicare for all by organizing and communicating our mission and sharing the goals and the vision of Medicare for all, goals and a vision only possible if we simultaneously pursue racial justice. If we are to win, it will take all of us.